Good evening, everyone. I welcome us all to today's session of Wellness Wednesday. My name is Dr. Fumi Aino, and I'm a member of the Green Mondays, the Green community, on whose auspices we are having this program today. I'm a foster manager of the Green community, and it's my pleasure to be the host of this program today. Speaking in the main to us today about the topic back pain is a doctor, Dr. Augustina Egwin. Dr. Egwin works with Dr. Connect and she's passionate about health. So I'm going to hand over to her. I mean, the topic she's talking about today is very important. I realized that about the global incidence of back pain is in about 7.5%. Over 500 million people suffer from back pain. So just that will just show us that this is a very, very important topic. And so without much ado, I'm going to hand us over to Dr. Augustina Egwin, who is going to talk to us about back pain. Dr. Egwin, you're very welcome. It's always a pleasure to have you here.
Good evening. Good evening, Simon. Good evening, everyone. How's everyone doing today? So like our host has said, we're going to be discussing back pain and back pain / backache. We know that the occurrence of this problem, this issue, is very high. An average person always complains of back pain. Oh, my back is paining me. Either it's been recurrent or it comes and go, or they've just experienced it once. It could be either waking up or at work. So we're going to be discussing about back pain, the causes, prevention and treatment, and also we'll be discussing the posture that could help improve backache and posture. So I'll be sharing my screen, and so we can go through. Okay. Can everyone see my screen?
Yes, we can see your screen.
Okay, all right, thank you. So I'm discussing about back pain, causes and ways to relieve back pain. So I know that it is a very, it can be a very annoying incident when you've not had it before. All of a sudden your back hurts you. All of a sudden you cannot seem to move. All of a sudden it feels like something is just stuck there and you just want to stretch it out, but it's not helping. A lot of people have symptoms of back pain. And I know that in this side of our world, people assume that once you have back pain, they call it malaria. You know, they're like, oh, maybe I have malaria. They start taking malaria symptoms and they forget that maybe their posture or they forget that maybe their posture on other things can cause them to have the back pain and backache. Even in well-developed countries, a lot of people have back pain and back issues. A lot of people even have neurological back issues that has to do with their spine. So some people even have corrective surgery just so that they can feel good. And so just so that they can have this day-to-day living. So some people is so bad that it's not just, I'll take paracetamol, it gets better. Some people have to actually, go through physiotherapy, go through surgical procedure. So we can see that back pain is really something to talk about. So just stick with me as we discuss what this is and how it affects each and every one of us. It even affects me because of, most times we are sitting and this could, even make it worse. So it says that back pain is a common ailment affecting 8 out of 10 people at some point in their lives. And this is high. 8 out of 10, that literally is going to affect everyone. So the spine has a difficult job in that the spine is the thing at the back that this man is touching. It has a difficult job in that it must support the weight of the upper body. And we know that the upper body has more weight, and still be able to bend and twist in any direction. So the spine is what helps you stand in an erect position, helps you bend, helps you twist. So, and this it has a great strain on it. So usually because of this great strain on the back, as one gets older, or as one gets at your daily activity, this could even get worse. So particularly among people who do a lot of sitting or who are underactive. So this is just minus if you have a medical condition. That one, so a lot of times they're even more silent than, if you don't have a medical condition. So those ones are more consistent, and you would have to go to a doctor, to get assessed, to know what exactly is causing that, and usually a specialist, a neurologist. So what are some of the causes of back pain? Many conditions may cause back pain, some like pregnancy. A lot of pregnant women complain of back pain, like, oh, my back is paining me. That is because of the pressure on their the lower part of their body, and because of the baby's position, and also because of that weight that the spine has to carry, because we just discussed that the spine, is what makes you bend. That area is what makes you bend, what makes you twist. So if there's a lot of pressure there, there's going to be, it's going to tell on the back. It's going to cause this back pain. Emotional tension are common, natural occurrences. Other factors that contribute to back problems include physical trauma. We can see the picture there. If you fall down, if you had if one had an accident, or maybe a rough play, someone hit you at the back, you can start having, really back pains. Or if you go to the gym and you do not stretch properly, you may end up having back pain because you have strained that muscle there. So physical trauma, athletic injuries, poor physical fitness, or being overweight. So the more weight you have, the more pressure that happens in the spine and the disc area at the back. So sometimes the disc even get herniated. That means it loses shape, and this can cause, really bad pain in that area, in that back area. So overuse or improper use of poor body mechanics. It means that poor body mechanics. It means that the way you use your back, the way you sit, the way you drive, the way you walk, the way you stand may cause painful muscle spasm or back strain. For example, stretching or tearing of muscles. So it's just like a rubber band, right? The more you keep stretching, the more you keep stretching, eventually it's going to tear. So the same way, if you keep stretching your muscle there, it's going to start aching. Some people even lose their disc and they have to undergo surgical procedure. It can get really serious. So stressful living or working habits. If your work is a job that you have to sit 10 hours, 8 hours, without standing up, 1 or 2 days is fine. But we're talking about, consistency, months, weeks. This can even lead to even more disastrous effects on your back. So it is advised. So we're talking about that in our slides about how you should stand up while sitting, how you should move about, and the kind of exercise you can actually do while sitting. So improper posture may cause back strain or sprain due to improper bending, lifting, sitting, or standing. A lot of us actually bench when we stand, and that's actually a very bad posture. And if we do this for the longest time, it's going to affect our backs. But how do we take care of our back? The mechanism, basically proper lifting techniques, maintain safe postures, so standing erect. Even if you want to pick up some items, there's a way to pick it up. We'll be discussing that. If you need to stretch, there's a way to stretch. Keep physically fit. You need to exercise, stretch. Remember, I mentioned that exercise can even cause back pain if you don't stretch properly. So a lot of people, when they go to the gym, they're just very excited. They want to lose weight. They just go on the machine, and they're fine. Then the next month, they're like, oh, what's wrong with my back? It really hurts. They forgot that they didn't stretch before or even after their exercise. It's good to stretch out your muscle, to loosen your muscle so it doesn't get stiffened. Because if it gets stiffened, you have this really bad muscle pain, and it causes that back to hurt. So stress management. Stress causes a lot of things. I'm sure we've discussed hypertension here. We've discussed lack of sleep. Stress even can cause your back to ache. Everything that psychologically can affect your body. So it's not different than if you're stressed, it can also cause you to have body pain. So I'm just disclaimer, not every body pain, not every back pain is malaria. So you can tell your your friends, your family, that if they tell you, oh, I'm having body pain, just tell them that it's not malaria, or go to a doctor. So good nutrition. If you eat healthier, your body maintains a good weight, your body maintains a good posture, and if you eat well, you might, if you eat well, if you have a good diet, if you have a good nutrition, you're not going to be obese, you're not going to add more pressure, or add more strain to that muscle at the back. So it's going to reduce back pain. So body mechanism, it is not how much you lift or move, but it's the way that you do it. Some people will tell you, but I didn't do anything. Why is my back paining me? Okay, but the little thing that you have done, how did you do it? So it's basically not how much you lift or move, it's the way that you do it. So how to lift? So basically, when lifting, use one of the bending techniques described above, or described in the picture that we can see there. We can see that when lifting, use one of the bending techniques described above. Hold the object close to your body. So hold it close to your body, lifting up with your legs. So instead of going all the way, some people, the way I wish I could do, if some people, the way they bend down, they just go all the way down. No, you're supposed to first go down with both of your knees, go all the way down, and then, put the object close to your body, then lifting up with your legs. So you're not just bending down to lift something, you're going gradually. Do not twist at your waist. Keep a spine in neutral position. So you don't want to bend your spine. That's your back. Those things that back, those things that you can feel at your back. You don't want to bend it. You don't want to be in an awkward posture that could really cause you to have terrible back pain later. So do not lift anything that is heavier than you can manage. Get help if the object is too large or heavy. So how do we stand? A lot of people actually, they bench like this, or they just don't know how to stand. It's natural. Even me, when I stand, I have to remind myself that that's not how to stand. A lot of time I slouch. So you're supposed to be at an erect posture. So improve your posture. Stand with your lower back in a neutral position by standing tall with your chin and stomach tucked in. So try keeping your earlobe. So just basically stand erect like the first man. So the second man you see there that is slouching is the wrong posture. So you shouldn't stand like that. So when you're standing for a long period, put one foot up on a footrest to reduce the tendency to stand with a sway back. So usually when people are like this, they just stand up and they do like this. But if you put your foot on a footrest to reduce the tendency. So when you put your foot on maybe something, you can get like a small thing while you're sitting. So when you stand up, you remove the thing and you get to stand like this. That compared to when you're just sitting and you just move like this. So avoid wearing shoes that have high heels or are worn out. This is for our ladies. They may look nice. However, high heels cause your feet to stand in an unnatural position. So disclaimer, you know how people say that, oh, when you wear heels, your posture gets corrected. That's not true. It actually worsens it in the long term. So in fact, these types of shoes alter your curves of your spine. It doesn't give your spine that erect position that it needs. It alters it. So it gives it a position that it's not supposed to, it's not supposed to have. So it causes uneven wear and tear on the disc. So in your spine is this shape. So if the disc is here, it will cause that disc to, between the vertebra and the ligament. So there are things in you that keeps your spine together. So it disrupts those things, and those muscles are even attached to your spine. So even though your spines are like this, I can't draw it well on my hand, but even though your spine are like this, there's ligaments, there are muscles attached to them. So if you wear heels, this can cause uneven wear and tear on the disc between the vertebrae. So it actually can really affect your back posture. I know that sometimes we can't help but, wear heels, but when you do that, buy the ones that are very, that are not too heely, but are like, very small heels. So you don't want to wear stilettos. It's not good. How to sit. So when you're sitting, like we can see, we don't want to sit like the first guy who is slouching. I know these things are very hard, to be honest. Like, you're busy with your work. You're not thinking, oh, I need to sit erect, but it's something that you can make a conscious effort to do. So when you see yourself slouching, you can just, stay erect. So sit in your chair with both feet on the floor and your back against the chair. So you're just backing you're putting your back against the chair. The chair should keep your back in a neutral position. So a neutral position is that you're not too forward, you're not too backward, your body is not too curved. So you're putting your back in a neutral position with a small but comfort inward curve. So we have a curve like this. So we are not sitting like this, we have this curve. So you can see a small but comfortable inward curve. So if you sit for a long period, it is essential to get up frequently and walk around. So like I said, we are very busy people. So when you're sitting for a long period of time, get up. If you notice that you've been sitting for 1 hour, get up, walk around. If you need to just go walk, take water, you can just walk around your room, 5 minutes, stretch, come back and sit. Do that regularly, it actually helps. So pay attention to your posture while doing activity that requires sitting. Even when we are driving, a lot of us drive like this. But you're supposed to drive erect, let your back be at a neutral position. Let your back be at a neutral position while you drive, which is the correct way. So usually you can bring your seats to closer to your wheels so that you can sit in that position. Because if your seat is too back away, you tend to curve, which is really bad. It causes back pain. How to bend. So when bending forward, always bend your knees. So like I said, always go down with your knees. Squat, keep your back. Always, neutral position is just a position that is neutral with your body. So you would know when you are neutral. You know that your body is neutral at like this. But when you start doing like this, you're slouching. Or when you do like this, you know that this is not neutral. Neutral, you can actually feel that you are in a neutral position. So you just go down on one knee, try to carry those things. If you don't try, if it's too heavy, call people to assist you. Don't be a superwoman or a superman, because this could have a disastrous effect on us as we get older. So aerobic exercises, they're just basically any type of cardiovascular exercise, like brisk walking. Anytime we see people with high BMI, we always tell them, okay, do a 30-minute exercise daily, because the more weight you shed, the better for your posture, the better for your back. If you're overweight, or you're not in a good weight criteria position, or your BMI is not right, it will have a strain on your muscle, it will have a strain on your ligament, it will affect your disc, and all of these things are very disastrous for our backs. So we do not want that. So we need to maintain doing weight management benefits. It increases endurance. So you notice that when you're maybe exercising and you're already panting, my back is paining me. If you do this on a regular basis, it actually increases your endurance, increases your capacity to cope with a lot of tasks. So there are a lot of minutes. There's 1,440 minutes every day. Schedule 30 minutes of them for physical activity. It cannot be overemphasized. Always exercise. Just 30 minutes is nothing, to be honest. Time goes by really fast. Your 30 minutes can be brisk walking, is very fast walking, not very fast, but fast walking. You can walk around your area, walk around your room, walk around your house. Just make sure you're getting that exercise done. Your back will thank you, because your back will not be so stiff. Any muscle that is stiff causes pain. It can even lead to arthritis later, if these are not being taken care of. So these are some of the exercises we can do: crunches, press-ups, bird dog. So, but this exercise, you need to do it right. So it's always good to have like a gym instructor or ask a doctor, okay, to tell you what position, or if physiotherapy is better, to tell you in what position you need to do a crunch, because some people do this exercise and it even makes their back worse because they are doing it wrong. And if you do an exercise wrong, it affects your ligaments, it affects, your back. So we don't want that. Okay, so how do I know my back is in serious? How do I know my back pain is serious? Because a lot of us are just like, I'll be fine. Today my back is paining me, I'll be fine. Whether your back pain is intermittent, that means it comes and go, very sharp, or it's just paining you and it's all the time, you're probably wondering if it should be a cause for concern. However, the severity of your symptom isn't the only indicator of whether your back pain is serious. For instance, you can experience intense pain from a pulled back muscle. It means that your muscle is being overstretched, but this will usually go away after several days of maybe resting, exercising. It means that you've worked your muscle too much. So if you rest, if you do the right exercise, you will feel better at home. But with something like a lumbar degenerative disc disease, it means that what holds your spine together or what holds it together is beginning to, let me say, like like a needle kind of that is rotting, or I don't know the best scenario, the best thing to call it. Yeah, a screw that is beginning to rust. It will not hold again. It will not hold that it should. That is what they mean by, this disc is being degenerated. Degenerative means something is dying. So that's a disease. That's now you need to see a neurologist. So you can experience a dull, moderate ache in your back, which will necessarily be intense. So that, like I said in the beginning, just because it's intense doesn't mean that, okay, I'm having, a severe back pain. Sometimes if it's intense, exercise or, rest or a simple painkiller could help. But if this is just, if this is a dull pain, you just feel like this is dull, but it's always there, you need to consult with a doctor, and so that the doctor can place you on a long-term treatment that will help you. So there are ways to improve back pain at work. So if you sit a lot, you can think about getting, I know a lot of companies are incorporating this into their working system. You can stand at work and go a long way towards combating neck pain. Studies have shown that a 54% reduction in aches in workers was switched on a standing desk. So with a standing desk, how does it work? You're not sitting, you're standing to work. And in that way, because you're standing to work, you're more in an erect, neutral position, and it would have like a good effect on your back rather than sitting down, because the truth is that most times when we sit down, we slouch. So that can be a very serious problem. So this desk could help. I know that in the Western world, they use it a lot, and it's been noticed to reduce, the complaint, the ratio of, back complaints, amongst employees. So you could change your chair. If you like to sit at work, consider swapping out your chair for one that is more correct. For example, the one that you can, pull up, pull down, that you can rest on, leaning chairs that could prevent you from slouching or leaning forward, which can cause back pain. So you need to get the correct, chair for work. How do we typically sit in a day? So I'm asking us now, how long do we typically work and sit in a day? Do we consciously make an effort, to stand up and say, oh, I've been sitting for too long, but let me stand up? Or we just forget and sit for the longest time? Okay. How long do we sit at work? Do we sit for a very long time at work, or we are very active when we sit down? Oh, no one is answering. So I guess you guys are very physically active then. Okay, long time and then I stand. Okay, that's good. No, you should sit short. I don't sit. Oh, yeah, that's good. It's not good to sit for long. It's perfect. Yes, I forget to stand as well. Yes, sometimes forget to stand. But what normally helps me is that I set an alarm every hour. It's annoying, but I set an alarm and it tells me, okay, you need to stand up. So I try to do that. So it's something that you can actually put into action. You have to be deliberate about it because we forget. Thank you so much. So how ways to improve back pain at work? Like we said, getting up from your desk and walking every 45 minutes. I sit for long and stand up once in a while. Okay, so you should do the reverse. Stand for long, sit for a short period of time. So you should do the reverse. Thank you. Walk walk every 45 minutes to an hour can help you avoid muscle strain. Like I said, reverse, stand more than you sit. I know a lot of us don't like to stand, but standing is actually very good for our body. This changes the stress that is placed on a particular muscle group and increases our blood flow to the areas that needs it. So we need to stretch. Simple stretches can help alleviate stiffness. Like I said, it's important to stretch, whether you're a gym person, because all those equipment can actually stiffen your muscle if you don't stretch after. So it's very important to stretch after our exercise. So there are some common asked questions like, why does my back hurt even every morning when I wake up? I notice people say that, oh, I wake up in the morning and my back really hurts. It might be because of your mattress. Yes. So a lot of people who have like long-term chronic back pain, they are always advised to get like orthopedic bed because it really helps. So you may need a new mattress. There are many factors that influence whether a mattress will be good, will provide a good night's sleep. So the firmness, the material, the thickness, the age of the mattress, your weight, and preferred sleeping position. If any of these are, if you could wake up with back pain, if your mattress is old, if you have a very old mattress that is already going inside, it causes a strain, on our backs. Like we said, we want even while sleeping, we want to remain in a neutral position. So investing in a new one should result in significant improvement in your back pain if you're otherwise a healthy person. Sleeping position. So certain sleeping positions strain your spine. If you suffer from chronic back pain in the morning, avoid sleeping on your stomach since the position flattens the natural curvature of the spine. So when you sleep on your stomach, your back is automatically doing like this, right? So you don't want that. You want that neutral position. So usually it's better to sleep if this is the only way you can sleep, place a pillow under your pelvis here. Place a pillow under the pelvis so that pressure that is on your spine is reduced. Or sleep on your back is better, especially if you have a firm bed with good material. So the other condition that that someone might have that they need to go to a doctor, that it's kind of an emergency. It requires a long-term treatment, like herniated disc, disc generation. We talked about disc generation. We talked about herniated discs. So in between the vertebra, there are sub discs that serve as a cushion for the bone. So there are things that your bone sleeps on. Let me use that term. There are things that your bone lies on. So when this disc becomes inflamed, it means that when they become a bit, swollen, or when they are red, like here, inflammation is when something is becoming, more swollen, or it's becoming like it's becoming more red. It's an inflammation. You experience back pain that's exhibited by inactivity. Therefore, the discomfort is heightened when you first wake up in the morning because those cushion that helps your vertebra are becoming, swollen and are painful. It's getting inflamed. So if it's getting inflamed. So usually when you exercise before bed, it helps. If it's just conditions that are because of our posture and because of our activities, exercises usually helps, with these things. And if you notice that it's painful, you can get warm water or warm compression packs and put right there. And this would relieve the tension there and helps with the blood flow helps with the blood flow at the back. So stress as well. Stress affects everything. Stress causes depression. Stress causes you can have high blood pressure with stress. So many other things stress causes. It's not surprising that stress can actually cause back pain as well. So standing or walking for long periods of time places stress on your lower back, in addition to the actual pressure on lumbar vertebra. If you're standing at a high demand job, your back muscles may tense as well, increasing the pain. So even if you're standing for a long period of time, walk. Let that place not be tense. Let it not just be like this. Let it loosen. Let it loosen. We don't want our muscles to just be stiff. We want it to loosen. Being overweight, every pound of excess weight places an additional 4 pounds of stress on your joints. Imagine this little pen and me adding this to it. Without me holding it, it's going to fall. So that's the same way if we have a lot of fat, we're adding stress on our joints. This includes what's called the facet joint, which are located located between our vertebrae. These are the joints that allows your back to be flexible when you have to bend or twist around. So being overweight can actually really affect us. So it's very good to take our health seriously, exercise, eat right, drink a lot of water. These things, we don't just say it as a rhyme, it is very important. It affects our overall well-being. So having poor posture for a day or two won't really cause damage to your back. But when you do it over the span of several years, it will affect, your spine, your disc. It will affect everything that is on there. So we need to consciously, you can set an alarm that, I need to stand in a neutral position so that my back will not hurt or I will not experience back pain. Sedentary lifestyle. What do you mean by sedentary lifestyle? When we don't do anything. Some people don't even want to exercise. They don't want to move around. They don't want to walk. So inactivity leads to what's called disuse syndrome. So disuse syndrome is basically the syndrome that, you don't want, you typically that you're not doing anything. Describes the effect on the body and mind where a person is not doing anything. It's just sedentary, not doing anything, not doing any exercise. If you're used to having a sedentary lifestyle, you could inadvertently be causing deterioration of your musculoskeletal system. As a result, you experience a long list of health ailments, including chronic lower back pain. So if you don't exercise, your BP is high, your back is aching, and it can be chronic unless you start taking physical activity seriously. It will continue to be like that. So how do we prevent back pain? Practice good posture like we've discussed, maintain a healthy weight, do physical exercise, engage in relaxation exercise. You can go to the spa, can get massages, or get massages from a trained personnel, not just a random person, because they could make it worse. So we are getting that from all this. I can see that maybe we understand that if we don't carry anything home, we should carry that only a trained personnel should handle your back. Don't take medication just because someone is taking medication and they tell you that the medication make them feel better. Always consult your health practitioner, visit a physiotherapist, exercise, go to the gym. You can go to there's someone in the gym that can help you and tell you the good kind of the best exercise for you. So like we talked about, exercise and stretching, mind your posture, losing weight. As previously mentioned, excessive weight affects the joint in your body. In addition, your lower back pain muscle needs to work harder to do simple tasks such as turning around, because there's so much things compiled there. If I put so much pressure on something, there's something that used to just turn around before. This thing is turning around like this. If I put so much thing, it now takes a lot of effort to turn it around. So we can see how much fat, actually affects our lower back pain. Our lower back, I mean. So treatment may vary depending on the cause of the pain, like I said. Your medical provider may suggest specific physical therapy exercises, like physiotherapists. Your doctor can refer you to a physiotherapist. He or she can teach you how to do each movement, as well as provide you with a printout with instruction that you can do at home. Like I mentioned earlier, just because you should do an exercise, you need to learn the correct way to do it. Just don't do something because you hear that it's good. Know the correct way to do it. And how do you know that? You need to see a doctor, you need to see a physiotherapist, you need to see your health practitioner. So conservative treatment include muscle relaxant, but disclaimer, you need to only get this from a doctor that has prescribed this from you. So do not just get creams. You can get the heat reliever. It helps. I mean, yeah, that one is really good at relaxing your muscles. So you could get that. But every other thing, injection, your doctor and your health practitioner should recommend that for you. Your doctor may analyze your gait, that means your way of walking, to determine whether you have any postural issues that needs to be corrected, or whether wearing shoes with additional support. So this is where something like this now, it's a personalized, customized orthotics, from people who have flat feet. So if your arches has gone flat, you need something like this. It helps posture, it helps reduce the pain on your foot, on your heels, and it helps your lower back pain. So this is really good. It is customized orthotics that you should get. Any health practitioner will probably recommend you for that. If you've been having this back pain for a long time. So in addition to physical therapy, you can apply heat therapy 15 minutes at a time. So this, like I said, eat therapy, you can eat spray or any like warm water. You can put it there to stimulate muscle relaxation and blood flow. Your lower back provides support and stability to your body when you're in an upright position. Each vertebra is separated by a jelly-filled disc that serves as a cushion. These discs can become inflamed when standing for long periods of time. They can also experience wear and tear with age. Standing or walking for extended period of time may aggravate this inflammation. Okay, so in summary, back pain is the most common pain that people have as a complaint to their health practitioner, and it affects anybody. It affects teenagers, affects adults, affects elderly people. So it's not just restricted to some certain age group, but as you get older, it can affect a certain age group. So we need to exercise daily. We need to take our diet seriously. We need to drink more water. You need to just be physically active. You need to stand in a good posture, and just be intentional about your body and how your body is. What you do with your body, because like I've been saying, your body is not just your body. There are some things that helps your body to stand and rest: the ligaments, the muscle tissues, the arteries and everything. So if those things are affected, it automatically affects your back. So you can always, if you've been having chronic back pain, you can always speak to a doctor on the Doctor Connect app. And get access to a doctor by visiting the Doctor Connect app and you'll speak to a doctor if you need an urgent muscle relaxant, something to help you, something to help relax your muscle at that time. So thank you very much for listening. If you have any question, shoot.
Thank you very much, Dr. Egwin, for that presentation. We've learned so much about how to prevent backache, all the things we need to do. And one thing I believe everybody should take home is that we need to be intentional, about our back health, the prevention, and the way we sit, the way we eat, the way we exercise, and everything. Thank you very much. Let's give some love to Dr. Egwin in the chat box.
Thank you.
Thank you. Now, do we have any questions? If we have any questions, please let's go ahead and ask. And while we're waiting for questions, I'd like to find out whether there are any guests in the house. You are not yet a member of the Green community, Green Mondays. Somebody invited you here. Please type, because we really love to welcome you. We love having guests among us, and we'd like to recognize you and welcome you. Okay, somebody is raising their hands. Infinix Hot 10. Okay, not sure who that is, but yeah, please unmute. Maybe you'll tell us your name when you feel. I've asked you to unmute. Maybe you have a question. Please go ahead. Can you unmute if you have a question, or if for any reason you can't unmute, you may type the question in the chat box. I've been trying to get you to unmute.
And yes, how long have you been using this mattress? And there's some underlying condition as well that can cause pain. So it's not just your mattress that might be causing this. If it's been chronic, how long have you been having this pain when you wake up in the morning? So if it's chronic, then you need to, speak to your health practitioner, speak to your doctor. If you need to be referred to a physiotherapist, or if you need to be taking a medication for a long period of time. So if your bed is very soft, it's most likely that you're going to be having, back pain. Or like I said, if you sleep on your stomach, it's most likely likely that the curvature of your spine is not well properly neutral. So that could actually cause you to have back pain. So maybe tonight you can try to put a pillow on your pelvis area. That means your that's the area in your private area. You can put a pillow there and sleep with your stomach. And if it improves, fine. If it improves, then you know that, okay, this is because of your sleep posture. Or if it doesn't improve, then you should definitely see, a doctor if this has been for a long period of time, so that you can actually be prescribed some medication, or you can be referred to a physiotherapist.
I believe that answers the questions. Okay, somebody else is raising their hands. Hadiza. Okay, please go ahead and unmute and ask your question.
Okay. Good evening.
Good evening, ma'am.
Yes, mostly I sleep lying on my back. And the pain is not this kind of pain. Is if I wake up in the morning, maybe from my bed to the toilet, I'll be walking like one very old woman. Then after some time, then I feel relaxed. That's why I'm saying, is it maybe the mattress or it's something else?
How long have you been having this pain for?
Almost more than 6 months.
Okay, so now this is more chronic, so you should actually go to a doctor so that you can get examined. And if you've been using the mattress for a long time, is it a soft mattress?
Yes, it's soft, because if I wake up, I'll see it is pressed down.
It's pressed down. Okay, so that mattress is not good for your back at all. So you might need to change your mattress. It might be one of the things that is causing you to have back pain. So you might need to change your mattress to a more firmer one. So you might need to consider doing that. But if it's been for a chronic long period of time now, you might need to also, start taking if you take medications and they're not prescribed, you need to stop taking them. You need to speak to a doctor. And
what I just do is I take a little of the reader balm and rub. Is the lower back near the buttocks. Yeah. That's where I feel the pain. So I usually rub and I take the reader capsules morning and bedtime. That's why I don't take orthodox.
Okay, so most likely try and change your mattress and exercise. Like I said, I buttress the exercising. You need to exercise at least 30 minutes every day, stretch exercises, and then just brisk walking, fast walking every day to release the tension, release the tension on the muscle, or the pressure on the muscle that is at your back. So those two things, you might need to change your mattress, regular exercise, you need to eat more healthier. So try the lifestyle modification changes first. And if it doesn't improve, you might need to start taking a long-term medication.
All right, thank you very much. Thank you.
Yeah, you're welcome.
Okay, thank you very much. Do we have any more questions? Or do we have any guests in the house?
Yes, please, I have a question.
Okay.
For those that have got flat feet, can you use insole into your shoes?
Can you use
insole? The one you buy from the pharmacy.
Insole. Okay.
Insole.
Insoles.
Okay, insoles. Okay, all right. I'm not really familiar with that, the insoles, but the problem with the insoles is that it's not customized with your feet, right? So sometimes it will not do your feet any good because sometimes they are too big or they are too small. So you need to get a customized, orthotics for your own feet. So this one measures your feet and it knows that this is specifically made for you. And that is the only way that it can benefit you. So if you just buy an insole from a pharmacy, it might not be made for you. You might think like it's size, like it's your shoe size, but it might not work for you because it was not specifically made for your shoe size and your shoes width and how maybe you have a narrow feet, a large feet, all those things matters. So you need to get a custom orthotics. It's much more better than getting an insole for sure.
The one I'm talking about, when you go to the pharmacy, you get it. There are sizes where you can, once you put your foot in, there's the one you can cut to fit your shoes.
Yes, the whole point of getting something like that is because of the arches. I don't know how good the arch of those things are, because it might just be like, okay, it will help you for a while. So the whole thing is the arches there. Like, for example, with this, the arches are kind of firmer, and it's really hard, and it helps your posture, and your balance. So an insole might not necessarily do that for you. It will help you in a way, but it might not necessarily give you the result that you require.
Thank you for that response. But now you talk about customized one. Where will if I want, for example, if I want a customized shoe, where will you advise to go to?
Okay, so we do it at our center at Just Small. So you can walk in, but you have to do a wellness check. You can walk in to do a wellness check. So when you do a wellness check, that's part of the test. But the shoe itself is costly. That's why I said you cannot just get it you have to get the one that's really costly, not so costly, but the one that is just specifically made for you with the arches. So it costs about 100,000, to get it customized, made for you. So that's the one that would benefit you for the long term, as far as I know.
All right, thank you very much.